Just straight down. And at least you get to see some clean ears. Well, this is what a normal ear should at least look like. The walls are smooth, no discharges. And that pearly gray wall at the back, that is the eardrum. One more. How come I have so many? Oh, I know. We're looking at different canals. So that was a clean canal. Sorry, I don't have labels. This is another clean canal with some pus discharge, just a little bit on the edges, but basically still pretty normal. There. Okay? And I can still see the eardrum all the way to the back. This one. Okay, I hope everybody's getting hungry. Yes, that's the ridge. So now you get a lot of practice looking at the ridges. See? And I'm through. So a bit of wax. And eardrum again. Okay? Sawa na kayo siguro sa kakikita rito. This one probably, hopefully, is more exciting. So, very hairy. There are some breeds that really have a lot of hair. Just because there's hair doesn't mean it's really going to turn out into an infection. There's actually a dermatologist who espouses that if it doesn't cause a problem, don't take the hair out. In this case, this one does. There's a lot of dark discharge. As you go through, it tends to block your view. So these are the ones that will need a bit of cleaning, then maybe some re-examination afterwards. Let's see here. See? So when you have this and you show it to the owner, we need to do a deep cleaning on your dog so we can evaluate what it looks like, they would likely say yes. I hope. This is the creamy one. Again, you can see that the hairs are all moist and wet because they do have a tendency to absorb and wick the moisture in. This is a lot of wax buildup. I turn the volume. You may not like my overtones. There, see? A lot of wax buildup there, around. This can be pus. It's, well, I think I like the way we best describe it as creamy white, or that would be Bavarian donut filling, for those who like donuts. You can see it comes all the way there. And I think, let me try it again. As you go through, it tends to squeeze itself out very nicely, all the way to the back. Okay? You could see the little bit of the hole there. This may be a little bit the same. Tell me if I'm going to run out of time, huh? So again, as you even as you enter, the edges of the scope will have a tendency to pick up all of the wax inside. If you recall Shrek, I think it was Shrek 1 or Shrek 2, you can actually make candles out of earwax. It just does not smell very nice. There. There's still more deep inside. And, oh, this one's nice. Let's see. This is not wax, this is more of, let's say, mud. There we go. This one I didn't get a close-up, but I think your screen is large enough. You'll be able to appreciate that I cannot see anything. It's all, malinamnam. See? That one really needs a cleaning. And which owner was not say yes to your recommendation of cleaning? Yup, the blob is there. Okay? So just imagine this while you're eating your dessert. Okay, let's open this place. It should turn itself right side up. There we go. Okay, this one is, let's see, more of the brown black discharge, again blocking our view. No way to evaluate the lining inside. Okay, so once you've shown all of this to the owner or you've seen it yourself, what's the next step? Oh, sorry, we have to go to the tympanic membrane. We all know that at the end of the horizontal canal, it's not perfectly horizontal. It has a bit of an edge sometimes. Let's see. Wait, trying to get bearings on this. There we go. So it doesn't sit horizontal. It sits at an angle. So sometimes you may have a lot of buildup of wax under here. So that can be normal. And there are tufts of hair at that end. That's normal. You don't have to pull them out. But that serves as your marker for where the tympanic membrane should be. If you see those hairs, but you don't see any membrane, that means the membrane's gone. It's already ruptured. You look at the membrane for hemorrhages, rupture, and it may be intact, but if it's bulging, that's highly suggestive that there's fluid behind it, and you're also dealing with an otitis media. This is just a view of the hairs that you can see. Okay, so that is normal. There we go. So, they have sort of quantified it in a way. If you have dark brown exudate and thick waxy, normal or hormonal, you can probably see ear mites. As I've mentioned, if your eyes are good enough, you'll be able to see the ear mites with just the scope, because the mere presence of the light sort of agitates them. They start running around and running around and running around. Or you can, alternatively, if you want to show it to the owner, you can still do your ear swab, put it under a slide, put it under the scope, and call them over and say, look what I found. Your pet has pets. Okay? Especially if they just bought it. You got that 2-for-1 deal. If you pale brown exudate, moderate wax, chances are it may be malassezia. If it's yellowish and purulent, like the, I mentioned the Bavarian cream consistency, maybe staph. Or if it's a bit more pinkish, reddish, moist, with a bad smell, that's when you run into trouble with the Pseudomonas, one of the most common and hard to defeat infections. You also have other types of frogs, such as E. coli and Proteus. Exam tips: always make sure you have fresh batteries. If you have a battery-operated scope, if it's the one that plugs in the wall, if you're not using it, keep it plugged in, because if you do not have light, you will not be able to see anything. If it's very dim, then you'll end up imagining what's there. Proper restraint. Have a trained assistant hold it. Don't let the owner hold it. They probably have no idea how to do it, because you know that with something that stiff inside the ear, there's a chance that the pet might move and you injure it, or it moves so much that you're not able to examine. I mentioned start at the tragic notch and work your way downwards. We've already discussed avoiding the Knoxon's ridge. Okay, when it's just one ear, this is important. Do the normal or less painful ear first. Why? If the animal already feels pain when you examine one ear, likely it will not allow you to examine the other ear. So start with the non-painful one first, so the animal will think, or the dog will think, it's not a problem. I'm going to let him look into the other ear. Okay? And also important, you have to clean the cones in between ears, meaning between the left and the right, and in between patients. Do not just let it to the side and then afterwards take a look at it. You can disinfect it with chlorhexidine, alcohol, or one of the main suggested ones is psilocybin, which is a quaternary ammonium compound, usually used for dipping instruments. So it avoids the transfer of organisms. You yourself would not want something that's been used on another patient be used on you. Unfortunately, the cones are not that disposable, unlike with people, so we have to clean it up. Now, this is the most important, cytology. That's a key procedure in otology because you can only visualize what's there, you need to prove it. So you collect samples from each ear by passing a cotton swab, or other methods are the ear loop, the red rubber tube, then you roll the swab. Do not rub, roll. You say to the knife, roll. Okay, so that even your assistant won't forget. And then label. If you have 3 or 4 slides there, you will not know who it belongs to. When I say be consistent, I usually use 1 slide per patient with the left and the right. I'm consistent in the fact that when when I'm facing the slide, I have the name written on top, and the left ear sample is on the left side of the slide, the right ear sample is on the right side of the slide. So even if I forget to label it in terms of left and right, as long as I do it that way, I know which side I'm looking at. Okay? Then you stain and examine under LPO.